Okay, welcome everybody. People are trickling in, so I'm sure somebody will let them in while I just make a start. So welcome to the last of your post-induction webinars with us at the school. This is an opportunity for you to ask any questions that you might still have or any clarification that you want in terms of all the information that you've had over the last 3 weeks now. So you have had a lot. So we're aware that you might have some questions that you feel that have been left unanswered. So we've got Slido again to use for the questions that you would like to ask. So you can either go to slido.com and put in the event code there, which is STP Web 4, or you can just scan the QR code that's up on screen. I'll bring that up again shortly for you to start posting your questions. Just to say we've got a large panel today. So we've got our 4 training programme directors. So Jane, Namia, Joe and Emma that you've heard from throughout induction. And then we're joined by Liz, who's our head of accreditation and admissions. We have Louise, who's our head of programme support, and Stuart, who's head of digital, and we have Chris, who's our professional curriculum manager. Just to say, I've put our school main inbox there, email address. So if there are any individual issues around university enrolment or employment checks or things that are very personal to you and you need to contact the school, then please do so via that email address there. Okay, what we will do is we'll go straight to the Q&A, which we've already got. Oh, sorry. Do that again. What we'll do is, I'll read the questions, and if any of you would like to answer, then if you want to raise your hand, that would be, so the people on the panel, that would be great. So are exams in January or summer? How many exams are there? Are they MCQs or essays, and are they online or face-to-face?
Do you want me to take that one, Sally?
Thank you, Liz.
Very good question. Obviously, you possibly don't know this, you might do this. We work with a range of universities, so it's difficult for me to sit here and say, for this particular university, it's this particular university, it's that. When you go to your induction at your university, if it hasn't yet happened, ask them. I don't want to sit here and give you the wrong advice. That would be wrong of me. Each programme might be slightly different. Each university might do it slightly differently. So when you do your induction, go and ask them. And if they are not quite sure, I'm sure at some point they will be able to clarify that for you. Don't worry if that isn't said up front. It will come and they will give you that information way in advance of whenever you need to sit any assessment, be it a piece of assessment coursework or be it an exam. So don't overthink about it at this moment in time. They will provide you with all the details that you need to know.
Thank you, Liz. How long should a reflective piece be for an OTA? Is 1 page enough, or does it need to be extensive? Anyone want me to answer that one? In terms of reflective practice, it's a very personal process. So we can't really say how long something should be when you're reflecting. I'm going to be putting on some webinars over November and December, and those dates will come out soon, around developing evidence for OTAs and thinking reflectively. And we explore what we mean by undertaking reflections. And one of the things that we touch on is that they don't have to be written. They might be something that you do verbally with your training officer or your assessor as well. So it's about the skill of reflection rather than saying that something's got to be a certain word limit. It depends on the actual context and the experience that you're having. But we do give you a lot of advice and guidance on that within that webinar and outside of it. So if you look on the Learning Hub, we have a whole section on developing evidence for OTAs, and part of that is how to do reflections. So hopefully that helps. So the next question is, what is your perspective on in-service trainees being asked to do lots of clinics from day one? I think this is a TPD. Yes, please, Jane, thank you.
So one of the things that we do say about particularly in service trainees is that you may have skills that you have when you come into it that you want to keep up, so you don't want to lose those skills, and doing a certain amount of in-service kind of clinics can help with that, but it shouldn't get in the way of your learning. So you need to have a discussion with your training officer and come up with a training plan, and that's the place to be discussing about these kind of things that you're being asked. They shouldn't be excessive. If that gets very difficult, you know, we are here to help, so please feel free to email us and we can talk about that separately. But that's the general kind of advice we give. If it becomes difficult for you beyond that advice that we're giving, contact us and we'll work through it with you.
Thank you, Jane. Is there an STP project and MSc project?
I think they're kind of the same thing, aren't they?
I was going.
The STP project is also called the MSc project. It's part of the curriculum library, and it is the same thing. You'll have to do slightly different things with them, though. The MSc project is done and marked by the university, but the STP project involves a little bit of extra things on top of that. Emma, do you want to add to that?
Yeah, it's just basically reassuring you that it's not going to be double marked. So the idea of the project within the department is making sure that you've got that departmental context, so that you've had the discussions with your project supervisor, that you've talked to patient groups, you've distributed your conclusions in appropriate ways. So things that are over and above writing a dissertation or writing a literature survey or writing the project proposal.
Thank you both. Can you use the £2,000 budget, what was it called, to pay towards any professional or additional certificates?
Do you want me to take that, Sally?
Yes, please. Sorry, Nimi,
Yeah.
I can't see.
That's okay. That's right. So the £2,000 is for you really to use to go to university. That's the main purpose of it, to use it to go to university, book accommodation for your academic course. If there is money left, then you can use that money, but it's not something you make it. You need to speak to your training officer to discuss first, and they need to agree to this before you go and do anything. So it needs to be approved by the department first, because it goes into the department budget. So there's processes that needs to be approved first.
Thank you, Namia. I'm the first STP trainee in my department ever. How do I shadow without seemingly getting in the way?
I'm happy to do that. I think that's all part and parcel of being a trainee. There is the inevitability that you will get slightly in the way, and you need to get in the way so that people don't forget you're there. But yeah, I find that trainees actually have a very good ability of being able to stand back when they need to and ask questions when is appropriate. So again, it's one of those skill sets that you learn as a trainee.
Thank you, Emma. Will I get an email once I get access to OneFile, Stuart?
Yes. Once your account has been set up, we will tell you that it's been set up. We are planning to do this, as we've promised you already, next week. And that email will tell you how to manage your access and a few steps that you need to step through to complete your account setup and manage your access. But yes, you will receive an email from us next week.
Thank you, Stuart. Can you explain the split of training activities again? Which ones need to be done in which year? I think that's to do with, is that the different types of training activities I'm thinking, Emma?
Yeah, I think the best way is to look at the curriculum library to work out which modules are in phase 1, 2 and 3. I think that's essentially is how I'm interpreting that question. If Joe interprets it slightly differently, then Joe can answer, but I would refer to the curriculum library.
Yeah, that's exactly what I was going to say. And have that page, that website to hand. I refer to it all the time when I'm doing stuff associated with the programme. And the other thing to just say is some of them will be in particular years, but some of them will run across some of your core things. You don't have to do it at a particular point in time. So just be really, really familiar with the curriculum and link it into your training plan, both as an overviewing training plan for the 3 years, but also a shorter one for little bursts of activity.
Thank you both. Is there a separate budget for a laptop?
That's something that we'd expect your employers to provide if you need it. They would be providing you with the tools that you need to be able to do your job. So that's a discussion. I think probably you won't get a laptop. I think you'll probably be expected to use IT equipment within the trust, but we don't provide money for things like laptops.
Liz, were you going to say something?
Jane said it far more eloquently than I would have said it. But yeah, there's nothing else to add, Sally.
Okay, sorry, Liz.
That's all right.
Are electives encouraged? And is there any support or information to organise them? Emma?
So electives was a phrase that we used in the old curriculum. This is the new curriculum that we are implementing, and there is an independent professional development module that could potentially be interpreted on an elective level, but you need to be very careful with that because there are some very definite training activities that are defined. You need to talk to your training officer because the idea is to look at how you need to develop in order to be able to benefit the department as well. So the two things need to go hand in hand. So if it's something that you agree with your training officer, then that's great, but equally there isn't any funding for it, so you would have to look at applying for travel grants or paying it for yourself. I don't know if there's any other TPDs that want to add to that.
No, thank you. Thanks, Emma. I'm a little concerned that I'll miss a piece of work on one file. Is there a checklist per specialty on what needs to be completed in the first year? Jo?
I would say this is an opportunity for you to do that checklist, align it with your training plan and the curriculum library. You will get a sort of a progression review where we remind you that you need to have done certain things within a certain time frame, but actually use this as an opportunity to map it out, because actually by doing it yourself, you'll have a better understanding of what you need to do, and then you can tick it off as you go.
Thank you, Jo. How come the curriculum seems to have more credits in year 3 than year 2? Core modules plus STP project adds up to more than year 2 and seems a lot.
I think there's a little bit of confusion here. So the STP project runs across your second year and your third year. So actually, if you add it all together, you finish up with 60 credits in each year. And Chris, again, might be able to add to what I've just said there.
Chris?
Yeah, so the mathematics is slightly imperfect in terms of adding it up across the 3 years. You're doing 180 credits because you're doing a master's in the university, and that is reflected in a different way in the workplace. But I think the complication of the mathematics is that a phase represents the end point where you must finish that module. It doesn't necessarily represent the start point of that module. So as Emma's just suggested, it looks like your MSc project is 60 credits in your third phase, but actually you're probably starting that much earlier. So technically your MSc project, your STP project will span your second and third year potentially. So it makes the mathematics of adding it up individually across a phase or across a year a little bit more difficult, but it will make more sense in your MSc. We use credits in a slightly different way. I think that probably made you more confused rather than less, but it does work.
And also the I think they mentioned the professional foundations in that question. That's across the 3 years anyway, isn't it? The 3 phases as such. Yeah. To be clear, we need to do training activities, uni work, and learn all clinical skills.
Yes, you do, but they aren't 3 separate things. I think what the whole point of an integrated program like this is that you learn the academic work at the university, and then that's applied within the workplace as you learn those clinical skills. So all 3 are very related, and you do have to complete all of them, but they will feed into each other.
Thank you, Jane. Chris?
Yeah, I thought it might just be worth clarifying that conversation we had earlier today, Sally. Learning your clinical skills you do by completing your training activities. That is the purpose of your training activities. They are there to develop your clinical skills. So they are, as Jane says, not separate things.
Thank you both. My trust induction and therefore my work email address won't be set up until mid-October. Can I still set up my OneFile then? Stuart?
Yes, absolutely. We need your workplace email before we can set up your OneFile. So the data request, the data form that we've asked you to fill in, don't fill it in until you've got your workplace email. So we can't give you OneFile access until then. That doesn't prevent you doing anything, really, because, well, many of you, as you can see in some of the other questions, are in university placements over the next few weeks anyway. But were you in a position to begin some of your training activities, some of those elementary ones, go do them. OneFile is simply the place where you share the evidence that they have been done. So any potential delay to your access to OneFile, you know, everybody's getting it next week that's supplied us with their workplace email, is really not any prevention whatsoever of any activity whatsoever. So the activity, as we've said in answer to various questions, the activity in the workplace is listed in the curriculum library. Any opportunities to do that you've planned with your tutor over the next few weeks, you should grab. And then, you know, it's once you've got access to OneFile that you can then submit that evidence. So I wouldn't worry about that too much, but we do need your workplace email before we're going to set up your.
Thank you, Stuart. What if you want to withdraw from the programme? Will you be expected to pay back for the MSc, and will you be able to apply again in the future? Louise?
Well, hopefully you're not at this stage considering withdrawing from the programme. However, if you do decide to withdraw from the programme, you don't pay academic fees back. However, if you do leave earlier, you may not get the MSc award. It will depend on how many credits you have completed with the university. So you might get a postgraduate diploma or postgraduate certificate, depending on which points you exit the programme. So yes, it's possible. And if you want, you can reapply, but you will have to tell us the reasons why you've relinquished a post at the point that you apply for the programme. And that would be then under review to determine if you would still be eligible to come back on the programme another time. So really hope you don't do that. But obviously, everybody has their own personal circumstances. But no, you won't have to pay any academic fees back at any point.
Thank you, Louise.
Can I just add to that as well, that if you want to withdraw because you've got something that temporarily stops you being part of the programme, we do have an EEC policy. So there are ways that you can get deferrals and step-offs, things like that. So when if you think you've got a problem that might make you want to withdraw, it's worth contacting us straight away, because we may be able to offer you a different solution.
Thank you both. I have to travel far for rotations. Is it reasonable to request flexibility around training hours whilst they're given that placements can last from 4 to 8 weeks?
I would say, again, that's something you should be talking to your training officer about, you know, and between the two of you ought to be able to come up with a plan that works for having to go to rotations. I'm sure they'll be very understanding if you're having to travel a long way, that it can be quite difficult. So yeah, I'd talk to your training officer as soon as you can about that.
Thank you, Jane. My accommodation won't get paid by the finance team at my trust after my manager chasing it constantly. Louise?
Yeah, that is really difficult. Unfortunately, there's limited support we can provide because the funding has already been sent by NHS England to your trust. So they do have the money that includes the money for your salary as well as your £2,000 for your travel. The best I can suggest is if you email us separately using the email address at the bottom of the screen, we can then follow up with you and perhaps contact your training officer and see if there's anything that we can do. But it really is down to the department to make sure they access that funding for you so that you can get that back through an expenses process.
Thank you, Louise. And Liz?
Yeah, it's just to add to that, really. My advice is if you've got some expenses that you're not sure about whether your trust will pay you back, talk to your training officer in the first instance, just to make sure that whatever activity it is that you are trying to engage with, you are within the trust policies about finance and making a claim in terms of whether it's travel, whether it's accommodation, whatever it happens to be. If in any doubt, talk to your training officer before you pay it. It might be that the trust can pay that up front for you, so you then don't have that cost yourself. But you'll need to talk to your training officer about that. We don't normally get involved to that level of detail because, like Louise has already said, the money's gone over to the trust and it's how they manage that as best they can for you.
Thank you, Liz. If my university classes start before I receive my occupational health screening results, will my salary begin with the classes or be delayed until November? Liz?
Again, I think you need to talk to your trust about this. If they've got if you've got an occupational health that you are waiting for before they can actually sign you off as being a full-time member of their staff, they are very unlikely to be backdating anything, in my opinion. But go and talk to your training officer and your HR department to find out what is possible. But be prepared that potentially until that screening has come through and you are classed as a fully paid up member of their team, they will not be paying you, I should imagine. But go and check it out yourself. It'd be one for me to give you personal advice here, but go and talk to your training officer or your HR department and just get some clarity so you know where you stand.
Thank you, Liz. What if you start a family mid-programme and require maternity leave? Louise?
Yep, that's absolutely perfectly fine. You can start a family in the middle of your training if you wish. Obviously, you know, life happens to trainees whilst they're on a 3-year programme, so it's perfectly normal, and we have processes to support trainees when that happens. What I would say is that if you are planning a family or you become pregnant, you should follow your employer's processes around maternity leave and make sure you're talking to your department in terms of any timelines or any support that you might need or any kind of risk assessment that might be needed. It's also advisable that you tell your university as early on as you can so that they can also plan with you the implications of any time you take away from the programme. And obviously you need to let us know as well. Normally we will ask you to just give us your maternity leave dates, and then we will update both the commissioners who are funding your training and also the university. And if we need to get together because the timing of your maternity leave or parental leave has an impact on the delivery of your training, then we can organise a support meeting between us, the university, yourself and your department, and we can come up with a plan that manages that. So it's perfectly normal. It happens with a lot of trainees, as you might imagine, so we're well equipped to support you with that.
And we've got there is a mature parents and carers network, which is a trainee-led network, and the details are on our website. And they did have a sort of networking space at the induction, so they're worth contacting as well, because they support each other in managing that too. So the wider sort of support around managing your training. So one for you, Joe. So for Dr. Horn, colleagues say that the histopathology STP is very academic and that we observe a lot, but not very proficient at any one thing.
I've been watching this question bounce around for about 10 minutes, thinking
I thought you would.
It's gone again, it's gone down again. I'm going to answer it. It's quick, guys. It's as academic as all of the other programs. The STP is a standardized framework. You'll see common themes across programs. Histopathology is not that different from all the others in that you have those same themes. So it is academic, but it's more reflective and more observation in the first year, like all the other programs. In the second and third phases, you are expected to get in there and do your clinical training. It is reasonably broad in that it doesn't just focus in one particular area of histopathology, because histopathology, can't even talk about my own specialty now. So I need a coffee, honestly. Histopathology has many different areas, if you've already worked there before, you will know this. So you could afterwards go and specialise in dissection, or go on to reporting, or molecular pathology, or into digital AI, for example. There are many areas you can go and work in. And what we didn't want to do was to pigeonhole you into one area at this point, and you're coming into your career. We want to give you as many opportunities as possible for the future. So we've gone with this at a sort of a broad brush to give you that nice foundation training to be a clinical scientist in histopathology. And just the one other thing I would say, that is, if you have any concerns or worries, or you're not quite sure, send us an email. Come and talk. I'm happy to come and talk to anybody, your training officer, etc. If you just want some reassurance, it's not a problem at all.
Thank you, Jo. Can I start a few phase 2 training activities now where useful? You mentioned that the phasing is defined as the latest year, not the spread across years. Emma?
I think you need to reflect on the purpose of the rotations. So the rotations gives you a nice broad picture and works out and sees how your specialty relates to other specialties. And it's then when you do your specialism, that's then built up from your rotations, which is why we say all rotations should be done. So your phase 1 should be completed before you then go on to your phase 2. Now, that doesn't mean to say that you need to wait until the beginning of your second year to do your phase 2, because you may well find that you might find that you do your rotations in less than a year. But provided your rotations are completed, then you can then go on to do your phase 2. Chris, do you want to say anything more about that?
No, I don't think so. I think you're about reflecting about the purpose of your rotations. I think it will give you a lot of insight to take forward into your phase 2 training. I think that's where your focus probably most reasonably be at the moment. As you start to work through and get a bit more settled, it might be an opportunity to start thinking about working towards some of those phase 2 training activities as well. But I'd suggest you walk before you run.
And again, with those webinars that I will be publishing soon, the date, where we explore some of the evidence around observational training activities, that also sort of contextualizes sort of the purpose of those types of training activities too. So thank you both. Hi, Jane. Is there any advice on when we should be thinking about accreditation within the cardiac STP?
Hi to whoever asked this one. I interpret this as meaning something like BSc accreditation or BHRS accreditation, which are the professional body accreditations that happen within cardiac. And I think you can be thinking about them whilst you're doing the STP, but we wouldn't expect you to have got full accreditation. That's not part of the STP. It's too much, really, because by the time you get to your third year and you start on your specialist modules, you haven't really got time to do those logbooks that you need for those. So I would expect most of our trainees to probably have done the theory exam if that suits what their training officers think, but you would probably need time after the programme to be getting your full accreditation, because it requires a bit more experience than you're likely to get whilst on the programme. The programme has lots of other stuff, it's a very broad curriculum, so it's just, yeah, you're not likely to be able to manage that within a year.
Thank you, Jane. Is it expected that we get paid for September, as we have had inductions and uni? Just want to be aware, as I'm still waiting for my contract. Liz, I was looking at you. No, you wouldn't realise I was looking at you, though.
I'm sure you were, Sally. I'm sure you were. It's a very similar going to be a similar answer to what I've said before. Go and talk to your training department. If you can't get hold of your training officer, have a word with your HR. I don't know, because you've said you haven't had your contract yet, so I suspect all your pre-employment checks haven't yet been completed. I don't want to give you the wrong advice. I know what we would do if it was a member of our staff, but I can't give you the advice for your own trust. Go and talk to your training officer and your HR department. If you are in any doubt, come back to us, but hopefully your HR department and your training officer should be able to give you a proper, firm answer on that one.
Thank you, Liz. If someone ended up having a long-term sickness needing treatment, would they be able to pause the programme until you have recovered? Louise?
Yes, absolutely. I think, as Jane mentioned earlier, we have processes available to support trainees. So if you were to have a period of extended sickness absence, we have the exceptional extenuating circumstances policy that can give you a few different options. One could be to defer your training for the period that you are unwell. And or you could then apply for an extension to reflect the time that you've had away and therefore the training that you've missed. What we would suggest is that you work with your training officer and then contact us if you feel that you've missed a significant period of training. We normally say up to about 6 weeks we want to be involved, because anything below that, we generally don't need to know if you've had the odd 1 or 2 days off. But if it's more than that and it's likely to affect your ability to progress in your training or complete your programme, then get in contact with us, let us know what's going on. We can then try and support you, signpost you to support options, and work with yourself and your training department to make sure that you've got all the support that you need. But yeah, it's definitely an option that you can interrupt if you are sick for a prolonged period.
Thank you, Louise. Are the trusts obliged to give us a dedicated study day? Louise?
I didn't know whether Liz was going to jump in on this one, but I'll make a start, see what happens. I think the word obliged is probably not what we would use. We do expect that you are given 20% study time. What that actually looks like really depends on how that works for you and your department. So for some trainees, it might work out as a day a week. For others, you might take it in a block, but it's really for you to work out with your training department what works best for you and for them. Study time, particularly if you are away from the department, you need to be flexible in that if there are things happening in the department that contribute to your training in terms of your clinical skills development, you might have to be flexible to move a period of study around. But we do expect that 20% of your training time is dedicated to study, but there's some flexibility in terms of how you take that. It could be a half day, it could be a day. It's just see what works for you within your training plan and with your training department.
Thank you, Louise. And Liz?
I couldn't have said it any more eloquently, Louise. Well done. In that sense, I'm glad you got in there first. Just to say, though, that study day might be at home, might be in the library, it might be in your department. It's kind of left to the discretion of your training officer in discussion with you as a trainee. So just don't assume because it's a study day that that's at home and you can do all the things. You need to negotiate this with your training officer. And like Louise said, it could be half a day. It just very much depends. But be mindful, if you're in a patient-facing role, if there are some patients coming in and you know that they're on the rota in terms of how they're going to be dealt with, it might be wise that you are there, because sometimes you might not see them. There might be quite unique cases that are coming in. So you just need to be flexible in terms of how that works and the opportunities that are going to be there for you.
Thank you both. From your past experience, do these STP years typically count in terms of pay progression in Band 6 after completing programme? Louise?
Okay, I can tell none of my colleagues want to answer this question. Right, so just a caveat, none of us are HR professionals and we don't employ you, so we can't really advise you on those grounds. What I would suggest you do is have a look at the NHS terms and conditions and have a conversation with your HR department to understand what the eligibility would be based on the contracts of employment that you've got. So that's certainly what you need to do. You need to talk to your employer about that. I don't think it's something that the school can necessarily advise you on, and I certainly wouldn't want to give you some information that was incorrect. So I think it's probably wise that we ask you to speak to your employer and your HR department about that.
Yeah, thank you. Will there be more study blocks next year? I'm assuming that's the university ones. Liz?
Yeah, I'm assuming exactly the same. So I think this is, you're talking about your university. Different universities do it in different ways. So some front load the academic teaching. So I think I've seen a question earlier about 5-week study block. I think that's pretty much KCL in London. They all do it in different ways. It just depends on their availability, their timetable, and how they do it. Talk to your university. Talk to them. They should give you your yearly timetable. They're not necessarily going to give you your timetable for year 2 yet. You're not quite there, but they will be providing you with information. Talk to whoever is the program lead in the university. If you can't get Joy there must be kind of a program support admin team within the university that should be able to help you, but don't panic. They will be providing you with timetabling and requirements to either attend physically, or if there are sessions online, that should be given to you in advance.
Thank you, Liz. Do we get paid a normal band 6 wage whilst at university, Emma?
So again, if you reflect on my induction presentation that I gave at the beginning, remember you are contracted to complete the STP program. So that means as part of your contract, you are expected to attend university. So lectures are no longer voluntary, they are compulsory. You are expected to attend every lecture. So consequently, yes, you are expected, you will be paid at band 6 when at university. I think there's another question that's bouncing around at the bottom that says, do you need to let your employer know if you're sick when you're at university? Because you are employed and it is expected, then yes, you need to go through your sickness policy with your employer, and you need to let them know so that they can then record it and follow through their sickness policy. So yeah, it's remembering that you are contracted to do this program. So yeah, anyway, I'll stop there. Anybody else?
Thank you, Emma. Yeah, the attendance is basically based on attendance at work and university. Yeah. Are the university modules the same as the OneFile modules? Chris?
Like you, Joe, I've watched this bounce around, but are slightly less excited about it. So if you have a look in the curriculum library, what you will see is there is a module, and each module has different parts to it. So one part of that module goes off into your OneFile, where it forms part of your personal portfolio. So the training activities that you'll see in that module will be replicated in your OneFile, and you'll be able to submit evidence against those. You'll also see in that same module in the curriculum library, for the vast majority of them, there are always some exceptions to the rule, it will also have an academic component. That is the information that you'll be going off and learning about at university. Now, small caveat to that I will say is that sometimes your universities won't deliver the modules in exactly the same way as they are presented in the curriculum library, but they will be delivering the content. It just might come out looking a little bit different at your university side. So what that means is for each module that you see in the curriculum library, there are 2 bits of it, which refers back to the conversation we had earlier, that your training activities, your clinical skills, your academic work, they are not separate things. They are all bundled together and there to help you become a proficient clinical scientist as you progress through the programme. If anybody's got anything to add to that.
Chris, is it worth saying while they are connected to each other, they are assessed separately? Because I wonder if that's what's behind the question. The
Yes.
training activities assess the work-based learning that you do, but the universities will have their own way to assess the range of content that makes up your MSc. So universities don't assess your training activities. With your training officer doesn't assess your university assessment. Keep it that simple.
Thank you both. Who do we contact if we need help? Louise. Don't contact Louise.
Yeah, me.
Just go.
There's a lot of help out there, is what I would say to you. I think the first port of call should always be your training officer. They are the person who are responsible for your training, but they are also responsible for you as an individual person and as an employee. If you have issues in terms of your academic programme, then we would always advise you to speak to your programme lead at the university as well. And perhaps just combine this with the question below as well regarding seeking support for if you have a disability. So your employer can provide a range of support. So you could, if you have a disability, you should be reviewed by their occupational health department, who will be able to talk to you about your individual support needs, and they'll be able to then make some recommendations around reasonable adjustments that can be applied in the workplace. So you would need to work with your training officer and the wider department to just explore kind of the support that you need. So it's really the first port of call is your training officer. If you need support at the university, all of the universities have disability support teams that you can access, and they will then work with you to develop what they call a support to study document, which will work through with you exactly what support you might need, and again, any reasonable adjustments that you might need for things like exams or anything else. And obviously the school is here to support you as well. We have a dedicated page on the website called Training Support. So there's lots of resources on there which you may find helpful. But obviously, if you've reached out and you need some support, or you might need an adjustment to your training, maybe an extension or a period of interruption, again, contact us at the email address that's at the bottom of the screen, and then we can start to have a conversation with you about your individual needs. But please, I would suggest make sure that if you are having some challenges, do communicate them early, because the earlier that you raise those concerns and those issues, the sooner you can get some support.
Thank you, Louise. And Alex has just posted the link in the chat to the training support site, so thank you. Can we use the £2,000 to attend conferences abroad, obviously ones that relate to our specialty? Emma.
I think really to back up what Namir's already said, your £2,000 is there for the travel expenses for your university and academic study. If there is any money left over, then again, it depends very much on how your trust chooses to manage that money and how your training officer manages it. So you need to talk to your training officer to take that one forward.
Thank you, Emma. When can we claim for expenses? After the block weeks? Liz.
Again, sounds like I'm passing this back to your trust. I'm afraid I am. It needs to go to, you need to take it back to your trust, talk to your training officer and ask them when they will allow you to do that. Because you're claiming for your expenses from your trust as your employer, it has to be within their policies and procedures. So if in doubt, have a conversation with your training officer and they should be able to advise you.
Thank you. I have 5 weeks of uni starting next week and then nothing for the rest of the year. From then on, is the only uni work required the assessments? Emma.
Well, I think you'll find that when you go to uni, the work that you are covering is not a question of just going and doing and then forgetting and going into the workplace. As we say, this is a course that is, the two are very, very closely linked. So when you then go into the workplace, you will be applying that knowledge. So you are constantly using that knowledge, and then there is ongoing, potentially ongoing coursework depending on how the universities work. But you need to have that. Again, we were talking about that extra, that 20% of study time. You may well find that, again, it's how the department, you work it with the department, but you may well find that part of that 20% study time, you're doing background reading, which is completely appropriate for doing training activities with. So you may actually combine the two together. Liz, sorry, you got your hand up as well.
You've said it all, Emma. I just thought you just got their finger first in fairness. You've said it all.
Thank you. I can tell you where to access the webinars. I've got it ready actually, because I was going to show you near the end. It's on our website, so you can navigate quite easily from the trainee section, and you will see resources from the STP Induction 2025, and you click on there. And we've got the presentations from day 1 and day 2, so the main event. And then we've got the post-induction webinars up there. So my colleague Michelle has already edited those and uploaded those. So all three are up there. And finally, our final question is, does study time of 20% mean a day in addition to the university teaching day? Louise.
Yeah, so as we talked about study time before, so it is 20%. It doesn't equal a day. That depends on how you have agreed things with your department. I know 20% of 5 days is a day, but it can be a day, it could be something else. That is in addition to the university teaching time or any time that you need to attend the university. So you have to go and attend the university for an exam, then that shouldn't be part of the allocated 20% study time that you're given whilst you're in the workplace. So it is in addition to the university teaching and assessment periods.
Thanks, Louise. Emma?
Yeah, I was just going to back Louise up with that statement. Remember, your first year is 60 academic credits. That's equivalent to 600 hours of study, whether that be attending universities, exams, and background reading. So all told, it adds up to your university time, and then 20% after that.
Thanks, Emma. And I think, Liz, you've just put something in, haven't you, about the study time from our website. So thank you for that in the chat.
There's a lot of information on the school's website. A lot of the things we've said today are already available for everybody. I think it's just, you just need to know where you're looking and you'll be able to find it. It's quite user-friendly, in fairness, but if there's anything that isn't there that you're not sure about, let us know. I'm sure it will all be there, I promise. But if there is anything you just think you can't find, let us know.
And that's it. If you can't, before you sort of approach us, have a look at the website. And if you really can't find it, then be in touch. Yeah, definitely. Jane.
Yeah, I just wanted to say one more thing about the university teaching and just emphasising the flexibility of it, and that you'll find that you might want more of that time if you've got an exam or an assessment due, and then you might want less of it when you haven't got any university, so you can concentrate on your work-based training a little bit more then. So use that flexibility, you know, don't kind of try and demand a day a week, because that's not really in your interest. You're better off being flexible and having a couple of days before a big exam so that you can be ready for that exam and then do more work-based training later on. That would be my top tip anyway.
Thank you, Jane. That's great. Well, that's it. That's it from our questions. I've just got a couple of things to share before we finish, but thank you to all our panel. So thank you to all our TPDs. So Jane, Jo, Emma and Namia. And thank you, Louise and Liz and Stuart also. I hope you all find it really useful, those of you that have attended today. Just before we finish, as I've already shared, this is the link to find all the recordings from the webinars that we've had, including the 2 half days. So the initial ones a couple of weeks ago, and the resources as well. So we've got the the slides are with those too. So if you want to look back at anything, or if you missed anything, you can look at those there. Just again to remind you about the website. So we've got, you know, if you go to the trainee section, which we showed you initially at the main induction, all the information you need really is linked to from there. So that's throughout the whole of your training cycle. So including, you know, the background to the STP, your responsibilities for your training, work-based assessment, right through to your final year assessment and everything in between. And obviously that QR code will take you straight there, but it's really easy to navigate and find as well. And part of that is the training standards, which we introduce you to in your first session. And that outlines your responsibilities in relation to your training as well. So those are the training standards that what you should expect from your training officer and department. But at the same time, we've emphasised the fact that you've got responsibilities against those too. So those are easily found on that trainees section. And just a reminder about the Learning Hub. We've got a range of resources on there for trainees and trainers. We did do a training for trainers yesterday, so an induction for new trainers, and this was shared with them too. So we encourage the both parties to access it, because we've got a range of information on there to support you with your training and meeting the responsibilities outlined in the training standards. But included in that, I think, resources to support you with reflective practice, and we will be promoting those over the next couple of months as well. But you will be given access to the monthly memo that comes out in October. And if you still haven't got your work email address, by the time that comes out, it does go on our website, and I'll make sure that we email a link out to everybody so that they have got access to it. So it might come to your personal email address from my training email for you to access it if you haven't yet got a workplace email. So don't worry about that. We'll make sure that you get a link to it, and that will outline some of the new those OTA webinars that are coming up as well. And just a reminder to familiarise yourself with those standards and values that we talked about in the initial induction, because they shape your curriculum and your practice, your professional practice too. And of course, the curriculum library, which I'm sure you've all, judging by some of the questions that have come through, you have been looking at the curriculum library, and that is your first port of call. And Louise mentioned the training support section, which we've got a QR code straight to there. But again, it's really easy to find on our website. And finally, if you have any further questions that you feel are still left unanswered, so if you've looked at the website, you've had that connection with your training officer, and you've discussed those things, and after you've been to the university, if you've still got some questions that you feel are unanswered, then please get in touch. But we do encourage you to obviously make contact with the university when you're there, and have those, that initial contact with your training officer too, and make use of our website also. And that just leaves me to say thank you very much, and I hope these the whole series of induction has been useful to you. But look out for other events that are coming up to support you. So there will be times that we will contact you by email to provide you with information, but also we'll advertise things through the monthly memo also. So thank you very much.